The medication that I have chosen to further educate the patient on is metoprolol, that's also known as Lopressor. Metoprolol is a beta blocker and that is used for high blood pressure or hypertension. The way that a beta blocker works within the body is that it blocks epinephrine, which allows the heart to beat slower with less force. When the heart beats slower, the blood pressure also gets slower in turn. These kinds of actions in the body allow for arteries and veins to widen, which improve blood flow. Administration of this medication can be with or without food. However, it is recommended to continue doing the same thing every day to make sure that you are not changing the bioavailability of the drug. One of the most important factors for taking a beta blocker for blood pressure is that you want to make sure that you're checking your blood pressure as well as your heart rate daily. And when you are doing so, if you have asystolic, which is that top number of your blood pressure, we want to make sure that it's above 100. If it's below 100, we need to make sure that we hold the medication for the day. And that's the same for if your heart rate is below 60 beats per minute. If we try to take the medication while we have a systolic of less than 100 or a heartbeat of less than 60, then that might further decrease our blood pressure or our heart rate, causing symptoms that we are wanting to try to avoid. The onset of action for oral dosing is within 15 minutes to an hour, and the peak of the medication is 1 to 2 hours after the medication has been absorbed in the body. The absorption of metoprolol is rapid and complete, and the duration of metoprolol is based off of the strength of the medication, and the dose that we're going to be prescribing for the patient is 25 milligrams. The patient that we're prescribing metoprolol 25 milligrams once daily to is a 30-year-old with hypertension. Safety has not been well established within the pediatric group for this medication so far, but considerations for pediatric patients includes that safety has not been well established for any pediatric clients for this medication just yet, but what has been researched is that the specific considerations for pediatric patients include that metoprolol can contain high doses of propylene glycol, which can cause fatal toxicities. The main consideration for any geriatric patient includes that this should not be your first line of use for hypertension. You should definitely try something before utilizing this medication. The most common side effects of metoprolol include dizziness, lightheadedness, orthostatic hypotension, sweating, tiredness or weakness, any chest discomfort, blurred vision, and can even cause confusion. If the patient and provider end up discussing discontinuing the medication, it's best to be tapering the medication off within 1 to 2 weeks. So make sure before completely discontinuing, we are tapering down our dose. In this case, 25 is the lowest start rate, so we would just make sure to kind of spread that out. I would then leave the floor open to the patient to see if they had any questions and if they needed any further education, as well as go over the script with them, make sure that they're able to pick that prescription up same day, and then make sure to schedule within 1 month, because I'm not going to prescribe any type of refills without seeing the patient one more time before then, just to see how our blood pressure and how we're feeling.